Riza, and then I'm in your adult health 1 class, unit term 2, section 1. And then now I want to demonstrate is the piggyback line, IV line, and then I have my MAR right here, and then I'm checking the doctor's order, and I want to check the doctor's order and then verify the correct medication, the dose, or the route, and the frequency, and then everything else. So I will make sure that everything is right. Doctor's order is a Zosyn, and then it has to be mixed up with 300 milliliter normal saline infusing for 4 hours, and then with 10 drops per milliliter. And then I'm checking my medicine, and then it is expiration date is June 1st, 2015, so this is still good. And then this is my MAR, and then I did my math. The medication order is 2 gram per milliliter, and then available is 4 gram per milliliter. And then after doing my math, it comes up with 0.5 milliliter. And then the drop factor is the 10 drop per milliliter times 300 milliliter of normal saline, and then divided by 4 hours and convert that hours to 60 minutes. And then everything go down to 13 drop per hour per minute for the IV. So now I'm checking everything I need. I have the medicine, I have the blunt injection, I have my needles, and then I have my tube, I have my IV, my alligator clamp, and then some of my disinfection, and I have my piggyback line. All right, so I'm going into the patient's room, and then knocking the door. Hi, sir. My name. I introduce myself. My name is Riza. I'm going to be your nurse today, and then the doctor's ordered to put another piggyback line on another IV on you, and then we have to mix it with the antibiotic Zosyn, and then I have to stop. I have to put it in your IV side. So I'm going to check the IV side, and then to see if there's any inflammation, anything wrong with it, or it seems like everything's fine. There's no inflammation, and there's no redness or anything. So I'm going to wash my hands and apply the clean gloves. Putting my gloves on. Put my gloves on. Gloves is on, and then okay, now what I'm gonna do is I'm gonna put the IV. I'm gonna document the IV, document the name of the patient, the date, the time that I'm giving, and then what kind of medicine that I mix it in it, and then the documentation, and I tape it behind the IV bag, and then I'm going to clean the medications container. I'm scrubbing it, and this is clean. I'm gonna take the blunt needle, putting it in, and then 0.5 air. I'm gonna stab it. I'm gonna flush the air, and then I'm going to take 0.5 medicine in it. All right, taking it out, and then putting the blunt needle back in, and I'm gonna change it to the regular needle. Putting it in, and then this is ready to go. And then the blunt needle will go to the sharp container. I'm ready to go. Everything, I'm going to check everything. Medicine's done. And then now I'm going to mix the medicine in this IV bag. All right. It is in it. I'm mixing it with the scoop method. I'm closing the needle, and then I'm gonna throw it in the sharp container, and I'm gonna mix. I'm mixing the medicine. Medicine is mixed, and then I am going to, since I already have the things up there, so I'm going to grab this. This is still sterile. This is just coming from the bag, and the bag was closed. And then I already put I already taped the documentation on the tube, and then to for the other nurse to know the date, the name, and then the date, and then the time that I'm using this tube line. All right, so I'm taking the two lines to end lines to make sure this is still gonna be sterile. Make sure nothing's touching it. Getting this, I'm going to stab it. All right, this is trash. Stabbing it. All right, this is on, and I'll make sure this is clamped. This is clamped, and then I will put this up here. Make sure this is not gonna be all over the place. That's good. And then I'm going to clamp this. Start from the bottom. Clamp this. Make sure everything's right. Clamping everything. Okay, so I'm checking everything, and then I already clamped this one. Okay, this is the next one I'm clamping from the primary line. And I'm clamping. Oh, it's all good. And then I thought I had it. Alright, I'm going to have this one hanging low. The primary, I'm gonna hang the primary low. Alright, this is lower. Maybe get lower than this. Okay, this is lower, and then since I clamp it, and then I'm gonna clean this. Clean this on the side, so I can attach the piggyback, the Zosyn, in this side. Okay, clean it. It's all clean, and then I'm taking this, opening it. Excuse me. Let me clean it again.
Wonderful.
So
That's
clean.
exactly what I have. And how are you doing, Mr. Jones?
I'm feeling good, actually.
Okay, well, I'm
All
here
right,
to
this is
insert
good.
an NG tube
It's
into
actually
your
a
stomach.
patch, and then
It's
I
gonna go
will,
in through your nasal
according to
passage,
the
and
math,
it's gonna
that
go
I have
suction
13
to the
drop
compress
per
and
minute.
increase when you
So
have
I'm gonna
those.
make sure. Oh, before I do that, I'm sorry, I forget to do this. I have to take it out first, and then make sure all the bubbles.
As you can see, my patient is
I'm
already
squeezing it
half hour, so I will
up to a half, and then I will make sure that all the bubbles is out, because that's dangerous. I see that the bubble is out. It's all good. And then clamp it back on, and then this is clean, and I still have to clean again. Both of them.
Whatever's easier for you.
I clean both of them
wash my hands.
with the alcohol swab. Attach it. But it's attached,
Go ahead and measure.
and I will make sure this is gonna be a 13
From the tip of the nose
drop an hour.
to behind the ear.
13 drop an hour will be about 6.5. No, 13 drop per minute will be 6.5. About 7 drop per 30 seconds. So I'll make sure that's what we have.
Put my gloves on. Okay. Now as we move here, I want to lube one end up to about 4 inches. From the curved part. Okay. And Mr. Jones, if you could just tilt
All right, so we have about 6 to 7 drop, 30 minutes, 30 seconds.
now let me know.
So that will be like about 13 drops per minute. So we did that. This is all good. And then
Wonderful. We're going in.
I'm going. This is gonna be right here. I just want to make sure that this is not this cable or this pipe or tube is not gonna be all over the place. And then we'll see that well, I'm going to inspect. I'm inspecting the side, the IV side. Everything's looking good, and then the label is up, and then the documentation is up. I'm going to discard these gloves, and I'm going to document everything that I did today, which is the piggyback for Zosyn, and then mixing in 300 milliliter normal saline, and then I'm going to document going to document the name of the patient, the piggyback, the medicine that is in it, and then the IV saline that's in it, how many IV saline, and then the date, and also the date, and also the time that I'm putting it in, and then that is for now. And I'm also gonna record or document. Alright, so after documenting everything, and then I'll leave the room, and I come back to check on the piggyback, and then I introduce myself again to Mr. Jones, and then check it again if it's still still the same patient, and then I'm inspecting the IV side, everything looking good. There's no inflammation, there's no swollen or anything. Everything's looking good. So I'm washing my hands, putting my gloves on, and putting the gloves on, and I'm gonna unclamp the primary. This is the primary. Unclamp it. And the primary, so I want to keep it going. Alright, so this is all good, and then I will clamp the piggyback, and I will take it out. Alright, this is out, and I have my alligator clamp with me, and I put this one on for the next nurse to use it, and I will hang it right here. This is all good, everything's looking good, and then of course I will unclamp this one from the beginning, and then I will establish, and I will hook it. I will hook it higher to the original place because there's no more piggyback, so I hook it higher. Alright, and I will re-establish the drop, and then according to my morphic-myosin, the drop is 8 drops per minute, so I will establish, and everything is unclamped, everything is good, and I'm just gonna establish the drop, and then it is supposed to be 8 drops per minute, which is 4 drops per 30 seconds, or 2 drops per 15 seconds. Alright, it is 2 drops, all good, and putting it back on. And then make sure that I record everything, and make sure that I document everything, and make sure everything is good. The IV side is good. There's no inflammation or anything. And I will also document the response of the patient's response. And then Mr. John says that he's doing all right. He's doing fine. The medicine actually working, and then everything is good. And I will discard this gloves, and then that's it. Thank you so much.